Okay, so this is quite a ways later, but I'm trying again. Okay, just a quick recap. I had this concussion event from pulling this nail. I didn't recognize or understand or relate it to anything. I thought it was just this wimpy event. What I now know is that concussive events can take up to 3 weeks for the air to kind of slowly let out of a tire or let out of your brain cells to basically slowly have a whole bunch of them die. They cause massive damage. I also know now, but I didn't know then, that you can have severe mood changes, especially depression. You can have major anger issues from a concussion, from a head injury. I didn't think you could have any mood changes. I never related that to anything. I also have learned that the significance of the brain injury is not related to the impact. So it doesn't matter how hard you hit your head against something or how the force of your whiplash, that doesn't seem to relate 100% or even the super high percent to the amount of damage. We could kind of relate it to people fall down all the time, and yet sometimes people have major broken bones and they need all kinds of screws and bolts and metal parts in them versus other people who never get hurt at all. And so the amount of impact isn't necessarily related to how big of damage can happen. Okay, I didn't know anything about that. I've since learned that the degree of damage is not related to severity. I've since learned that whiplash events are treated the same way as impact events. So each day, over the time, my mood changes got slowly worse and worse and worse. I had a non-stop headache that would increase throughout the day, especially during math classes where I had to answer a lot of questions, especially during PE classes where there was a lot of different movement and noise going on. And one thing, I did some of the things that are absolutely worst for a concussion. I didn't stop being less active. Went on a bus trip and had my head against a window and I was rattling against the window for hours or an hour. I kept being really active in phys ed classes. I didn't alter my sleep. I didn't slow down. I was around a ton of noise. And I totally ignored it. So all the things really wrong to do. Okay. By my second week, getting headaches worse and worse, taking lots of medications, trying to pretend maybe it's just allergies or a cold or something. It's getting severely depressed. I started crying randomly, not something I do a lot of or even very much. I was extremely moody. My wife would take the kids the second I got home and they would go for trips after school to the grocery store and away on the weekend as much as possible. I was extremely tired, but I didn't think concussions can cause any mood changes. Never thought about it. I just thought I was totally losing it. Scariest part was I had no idea what was going on. So finally I went to ER and said I felt depressed. And by that time I had cried almost a whole day straight, non-stop. I couldn't even figure out why I was crying. All right, in ER, I told them I was depressed, so they gave me the standard treatment for depression. They told me to take some meds, take some time off work, go for sunny walks, and just relax. It's easier said than done. Unfortunately, the treatment of going for sunny walks and getting extra exercise is some of the worst things to do if you're in the really critical stage of concussion where you're in the very early stages. I went past some really loud lawnmowers and a leaf blower, and my head was just ringing like a church bell that wouldn't stop going on and on and on and on and on. It was just insane. I got home from one long sunny walk, one walk only, went on bright sunlight, was told I was supposed to be good, go out in the nice sunshine. Went for one walk, 1 hour, got home, fell into bed, and I went from sleeping 16 and 18 hours a day and in tons of pain in between and nonstop to now 20, 21, 22, 23, 24 hours straight with ice packs continually on my head, no covering, just taking the ice pack straight from the freezer, straight on my head every time. And that was the only way I could survive the intense pain. Taking drugs constantly, it was just, I couldn't even understand it. I now want to mention the elastic effect. You can see the elastic effect picture of me marching out elastic and down. I found at this time, and this is in early December, late November, I found this weird thing that would happen just every once in a while, and it's happened a few times since then, but not too often. Where if you're really focused on wanting to do something that's critically important, go to a doctor's office, go to ER, something like that, where it's the only time you can do it, you must be there. Your adrenaline gets going, maybe it's you really want to get out to a family reunion and really have to be there, put up a pretty face, or a mostly pretty face. You can sort of ignore your symptoms or override them or get your adrenaline going for a few hours, 2, 3, 4 hours, and seem mostly normal as long as you don't push it too far. But the farther away from your normal you go, I found anyway, the worse the effects afterward. So doing the 11 minutes or 10 minutes of this video earlier, I was in bed for days and days in extreme pain. When I show up at doctor's offices, I had to be awake, I had to be communicatable, whatever that means, to a doctor for that 5 minutes, 10 minutes, whatever it happened to be, in the ride there, usually, and back. Well, I could do that, but to do that, I'd override everything, and I would say, okay, I'm in pain all the time. Are you in a ton of pain now? Well, not really. I got this buzzing going on, but I'm not really sure why I'm not in pain. It seems really weird. And if you're a doctor who doesn't know concussions a lot, you say, they're making it up, they're fine. I cured them. Go home, all better. So I went to ER, said I had these major headaches that don't go away. Okay, well, lie down. Okay, close your eyes. Okay, I put earplugs in, put an ice pack on, got an ice pack from them. Okay, so I have my ice, I'm laying down, can't hear anything, can't see anything, not talking to anyone, and most headaches will reduce in that time. Well, with my brain, if it's being overworked, with anybody's brain, with concussions, you lower the inputs and the headache will reduce some. Unfortunately, with concussions, the second you sit up, try to do something, the headache increases in intensity again. So they would say, okay, so your headache's mostly gone. When I'm laying down, not communicating, okay, good, you can go home. I'd stand up. My headache would be back just as bad as can be, but I'd be sent home. And nowhere further along. My doctor, family doctor, concussions aren't his specialty, and that's readily apparent. Well, I'd go there, close my eyes, he'd even have him turn off the lights. I wouldn't walk, I'd be sitting most of the time, take earplugs in, talk to him for 30 seconds, he'd check my reflexes, look into my pretty eyes, tell me to follow his finger, if he even did that, tell me to walk 4 steps. Even totally drunk people can pass that neurology test 20% of the time. They can seem normal. So if that's the only way you're still testing for concussions, you need to advocate for yourself, and you need to seek out help beyond those people who you are currently seeing. There's a few different types of tests. ACE, acute concussion evaluation. If your doctor's not asking about physical symptoms, cognitive symptoms, emotional symptoms, and sleep symptoms, then there's a problem, because they need to be. And you need to advocate for yourself if they're not. These tests are online. Heads Up Concussion. There's some wonderful apps as well. Very easy. What, you don't have to be a doctor, you don't have to be, you can just look at the questions. But remember, whether you're a teacher or a parent or anyone, concussions don't always show up the first day, they don't always show up overnight. NHL has figured this out. That's why they kind of wait, and they can sometimes do it after the fact. They'll say they're out of work for a week or two, okay? Because they're learning that. They're learning about this elastic effect. Okay, so after several visits, Tandy and I figured out two things in mid-December. Most likely, again, don't always diagnose yourself, but we had two guesses. One is either I have post-concussion syndrome, fairly unlikely, but possible. Or two, I had some sort of brain tumor that I was dying from, or at least just not living from. So those were our guesses. We were stuck. We'd gone to ER 3 or 4 times and hadn't made a whole lot of progress there. Finally, we went to a neurologist in London. Sorry, I have to slow down now. I got about a minute and then I have to stop. Told the neurologist my story. Boom, you have post-concussion syndrome. Don't go back to work. Make sure your symptoms are ready. And I'm a very busy neurologist, so I'm going to send you back to your family doctor for follow-up treatment of post-concussion syndrome. So finally, in early January, I found out about a place on London Line, Archway Health and Sports Services, that treats concussions. That has, make sure you go to an accredited place, and they are, but there's some that aren't. But make sure if they're a place that's accredited in some way, and they're teaching doctors how to treat concussions, that's a good sign that they know what they're talking about and they're keeping updated. If they're not keeping updated in some way, in some form, that's probably not the place to go. Anyway, I went there, did his 40-minute assessment. It's not a 2-minute assessment. Failed it massively right away. You have really bad post-concussion syndrome. There's no chance you should be anywhere near attempting to do anything. Slowly do a tiny bit of exercise. Alright, gotta stop there. My head's really going.